Olivia. Are you ready to go home?
Mm-hmm.
I have your discharge instructions here. Well, let's go over them. So what I brought in was information about a stroke, an ischemic stroke, to be specific. An ischemic stroke happens when blood flow is decreased to the brain, cutting off oxygen, which is caused by a blood clot or narrowing of the arteries. Risk factors for a stroke are high blood pressure, high cholesterol, tobacco use, type 2 diabetes, obesity, sedentary lifestyle, and an unhealthy diet. Symptoms of a stroke, this is what you should watch out for, and have your family kind of watch out to prevent a future stroke or know if your symptoms are showing up. So B stands for balance. If you're needing to use the furniture more, or you just can't walk very straight, or you can't walk at all because you can't maintain your balance, that is a significant sign. E stands for eyes. If you notice any blurred vision, double vision, visual changes that are very sudden. F stands for facial drooping. If you notice or someone says, that your smile isn't the same or your eye is drooping. So if you look at this picture here, you see how his smile is not even. So that's what we mean by facial drooping. A is arm weakness. So if you hold out your arms like this and one of your arms drops and you just, no matter how hard you try, you can't bring your arm up, that's a sign too. S stands for speech difficulty. If you have a hard time getting your words out or your speech sounds slurred, be sure to be watching for that. And T stands for time. So if any of these symptoms up here occur, it's time to call 911 and go to the hospital to get checked out. It's important, whoever's with you, that they know when these symptoms started. That's important for treatment purposes. If you did have a stroke, your complications would be aspiration. So when you cough and you say that your water went down the wrong pipe and you start coughing and kind of hurts in your chest, that's aspiration. That means it goes, instead of going into your stomach, it goes into your lungs. When you have a stroke and you can't swallow correctly, aspiration is a possibility. Unilateral awareness of the affected side means that no matter how hard you try, you can't, you can't address that side, you can't feel this side. This side's completely numb or not there. You can't, no matter how hard you try, you can't lift up your arm or you can't dress yourself. So that takes a lot of therapy. Inability to speak is called dysphagia. Dehydration and failure to thrive happens with, sometimes if you have a significant stroke, you have to change your thickness or consistency of your food and your water, and sometimes people just don't tolerate that very well. So dehydration and failure to thrive is definitely something to watch for. Diagnostics, how do we determine if a person had a stroke, would be immediately going straight to a CT scanner. And that would give us a good picture of your brain to see if there's any lack of oxygen. An MRI, and then this scale called the Glasgow Coma Scale tells us your mental status and lets us know if there's any mental status changes. Any questions so far? Okay. Great way for treatment is to determine if you are a candidate for a thrombolytic therapy, which is very important of knowing our last known well, or when did the symptoms start. You have a 4-hour window roughly to receive that medication. Blood thinners helps keep that blood nice and thin, can go through the narrowing of the arteries and get that oxygen to the blood, into the brain. So low dose aspirin and extensive physical therapy, speech therapy, and some social services if needed, for any interventions at home, if you were to have any further residual from a stroke. So stroke prevention. How do we prevent a stroke? Do you know? Okay. So eating a well-balanced diet, getting lots of fruits, vegetables, a lot less fried foods, fats, cholesterol, a lot less sweets, making sure you drink plenty of water, don't drink alcohol, don't smoke, don't use tobacco, exercise 30 minutes a day at least. Doesn't have to be vigorous, can just be walking or something, you know, if you have a specific hobby that you want to do, just something to keep you active. Bike riding, doesn't mean that you have to go into the gym and start lifting a bunch of weights. You can just do something that would get your heart rate up just a little bit and keep you moving. Reduce sodium diet, so don't add as much salt to your foods. And then educate your family and friends for support. Okay. Stress management skills, that is a big one. So if you're pretty stressed out, that can cause your blood pressure to go up, which can also cause a stroke. Okay. So when do we call 911? So we went over those be fast skills or signs and symptoms. Okay. So weakness and tingling in the body or on the face, sudden blurred vision, chest pain, shortness of breath, any seizures, hypertension, which is high blood pressure that's not controlled by your medication, mental status changes, and pounding heartbeat or palpitations, which usually you can feel like your heart skipping a beat or doing something that it doesn't normally do. Okay, so those are ways to prevent a stroke and what the treatments would be. Do you have any questions so far? No? Okay, so can we go over this B FAST again? What does B stand for?
Balance.
Okay. E
Eyes.
and F
Facial drooping.
and A.
Armedness.
Good job.
Speech difficulty.
Okay, and T.
Time to dial 911.
Good job. Do you think it would be helpful if, like, we printed you out this in a big piece of paper like this to where you could keep, like, next to your chair, or, you know, kind of give it to other family members to kind of help notice the symptoms of a stroke? Do you think that would be helpful? Okay. All right. Well, if you don't have any other questions, that's all I got.